The World Health Organization defines palliative care as an approach that improves the quality of life of patients and their families facing the problems associated with life-threatening illness. Worrying, however, is that only 11% of those who need pain control within the wider context of palliative care can access it. The demand is even higher with disease outbreaks. Mark Mwesiga, the Executive Director, Palliative Care Station of Uganda, says coronavirus has only increased anxiety among patients they take care of, raising concerns that their health conditions may worsen.
But it is the anxiety, it is the fear of the unknown. It is this kind of, they have isolated my relative, they have taken them to Mulago. What is happening up there? And the palliative care approach is very good at handling fear and anxiety.
Mwesiga reveals that many hospitals which have adopted palliative care do not have homes essential in rehabilitating patients. But with the recent presidential directives, her plan has been laid.
But hospices are making sure that they can connect with people on phone. They can connect with patients and their carers on phone. So we are doing what we are calling more home visits, but mainly on phone and communication. Except where it is very necessary, then since the Ministry of Health has allowed that healthcare workers can move, then the healthcare workers move to visit the family, especially at end of life. This is somebody who is passing away that we can talk about. But hospitals have made sure that, for example, the medicines for these 2 weeks, good enough. Progressively, the presidential directives came in and you could tell what is going on. The majority of hospices prepared their patients very well. They had to do medicine refills to make sure that they can take them at least a month. They had to make sure that they share their contacts and telephone numbers, that in case of an emergency they can be contacted. The hospices are open. In case of an emergency, a patient can come in and consult. And some of them are actually setting up toll-free numbers, and we would like to see more support.
This comes ahead of the Ministry of Health stakeholders meeting on how palliative care can be incorporated in healthcare during the COVID-19 pandemic. Over 800,000 people have been infected with coronavirus and over 30,000 deaths across the world. Zahra Namuli, NBS, live at 9.